Hi, this is Dr. Karen Becker on part 3 of Cushing's disease. In part 1 and 2, we discussed that there were 2 types of Cushing's disease, atypical and typical. Typical Cushing's disease is when the middle layer of the adrenal gland overproduces cortisol. Atypical Cushing's disease is when the outside layer and inside layer overproduce other types of hormones. So the outside layer of the adrenal gland can overproduce aldosterone, which regulates electrolytes. That translates into electrolytes abnormalities in your pet's blood work. More commonly, the inside layer of the adrenal gland overproduces sex hormones, estrogen, progesterone, and testosterone precursors. And although we don't know why animals develop atypical Cushing's disease, we do have some ideas that could predispose pets to developing this particular syndrome. In my opinion, early spay and neutering, early dog and cathood desexing absolutely has to participate in part of the upregulation of sex hormone production by the adrenal gland, because when we spay and neuter dogs early, and when I say early, before puberty, so before 6 months or earlier, those animals their endocrine systems, their glandular and hormonal systems never had a chance to fully develop. So then when we desex them, we pull out the ovaries and the testicles, so all of their sex hormones are taken out of their body and they literally become asexual. And that's not a problem. However, it becomes a big problem later on in their life because their bodies still require some natural hormones for normal biologic function. And what's the last remaining source of tissue in a pet's body that can secrete some sex hormones? You got it, the adrenal glands. So the adrenal glands are asked slowly to produce more and more sex hormones for a body that needs them, and at some point this simply can't keep up and overproduction of sex hormones from the adrenal glands occurs. Now, not all veterinarians will tell you that this is what's happening, and not all veterinarians believe that atypical Cushing's is even something that you should be treating. I do treat a lot of atypical Cushing's at my practice because we see a lot of symptoms pertaining to hormone dysregulation, and by balancing out your pet's hormones, you see not just physiologic improvement, but mental and emotional improvement as well. So atypical Cushing's disease certainly can be influenced by when and if you desex your pet and how early desexing occurs. The second factor that can change hormone regulation in your pet's body are substances called xenoestrogens. And xenoestrogens are chemical substances that mimic the effects of estrogen in your pet's body. And because hormone disruption is a central focus in Cushing's disease, substances that facilitate hormone disruption need to be evaluated, including xenoestrogens. Xenoestrogens are found in fertilizers, pesticides, soils, a lot of non-organic meats, as well as plastics, including potentially your pet's drinking bowls if you're using plastic drinking bowls. So pets are exposed to just as many external sources of estrogens as we are. And of course that can influence their own adrenal glands' production of estrogens, and that can negatively influence your pet's endocrine balance. So we need to be thinking about potential external sources of estrogen-like compounds that can be causing adrenal stress for your pets if your pets have been diagnosed with atypical Cushing's disease. Dr. Jack Oliver, who is an endocrinologist at the University of Tennessee Endocrinology Lab, suggests actually some natural treatments for helping to reduce the amount of circulating hormones with atypical Cushing's patients. He actually recommends considering using melatonin first on his list of arsenal of treatments because number 1, it's non-toxic, number 2, it's cheap, number 3, it's pretty effective in the early stages of atypical Cushing's disease. Dr. Oliver recommends that pets be provided melatonin because it helps reduce both estrogen and cortisol levels in your pet's bloodstream, and it's an easy way to provide some management for atypical Cushing's with no side effects. Dr. Oliver also recommends for pets that are dealing with elevated estrogen levels using high lignin flax hulls. Now, not flaxseed oil, high lignin flax hulls. Flaxseed oil doesn't have enough of the lignins present, but high lignin flax hulls actually are phytoestrogenic, and that seems kind of contraindicated. You'd be feeding estrogen to a pet that's already having estrogen dominance problems. But believe it or not, there's a negative feedback. So providing phytoestrogens orally sends a feedback mechanism to the adrenals that tell the adrenals to pipe down on the estrogen production, and overall can be quite therapeutic at helping to manage, not cure, atypical Cushing's in dog patients. Integrative veterinarians use a whole host of glandulars, homeopathics, nutraceuticals, Chinese herbs, as well as adrenal balancing nutraceuticals to help manage atypical Cushing's. So if you have a pet that's been diagnosed with atypical Cushing's disease, or if you believe your pet could be acquiring this particular syndrome, working with an integrative vet is a pretty good idea. Most importantly, I want you to remember that disease is never black and white. Your pets are never vibrantly healthy and then acquire atypical or typical Cushing's disease a week from Tuesday at 1 o'clock in the afternoon. Never happens that way. The only time your pets are vibrantly healthy and then in a state of disease is when your pets are hit by a Mack truck. And that's the truth. Other than acute trauma, disease is on a spectrum, and your pets are either headed towards immunologic and endocrinologic balance or away from balance. And my biggest frustration with traditional veterinary medicine is that we tend to categorize disease as black and white, which means if you're working with a reactive veterinarian, not a proactive veterinarian, your vet will probably tell you, oh, your pet's fine. And you say, you know, I'm just seeing some symptoms. They're losing their muscle tone and they're drinking a lot, and their skin color and their attitude, is changing, and their hair texture is changing. I just don't like what I'm seeing. Oh, it's fine. It's a normal part of aging. We, as veterinarians, we tend to not address these issues until they're so clear-cut that disease has become black or white because we've waited so long. So my pep talk to you today is to, if you believe that your pet is having changes, that you're suspicious where there could be endocrine involvement, ask your vet to check. The only way to treat these syndromes early is to identify it early, and the only way to identify it early is to work with a proactive veterinarian in determining that yes, indeed, your pet has this syndrome going on. Probably my biggest frustration is that veterinarians oftentimes through charting blood work, through clinical pathology, which is charting changes on blood work over a period of several years, what we tend to see is as thyroid levels drop in dogs, the ALP, alkaline phosphatase levels, tend to slowly increase, and that's a pretty clear marker that your pet's endocrine system could be becoming off balance. And you need to begin working with your veterinarian to identify some of these trends in your pet's blood work so you can identify potential shifts in their endocrine system earlier rather than later. Most of disease actually is in the gray zone, in between black and white. So if you believe your pet is headed into the gray zone, which is not vibrantly healthy, but not yet racked with disease, that's the perfect time to act and identify potential barriers in your pet system that could be contributing to moving down the gray spectrum into the black or diseased areas. So we recommend that you work with your veterinarian and identify every biochemical change on blood work that could be abnormal, including ALP. Do further diagnostics that were discussed in video 2 if you have concerns about potential secondary changes in your pet's adrenal glands. But most importantly, I'm going to tell you, you need to do the common sense things in reducing cortisol overproduction in your pets, which means prevention is, of course, what I'm going to recommend for you. We're going to recommend that you eliminate carbohydrates, corn, wheat, rice, because carbs prompt an insulin release, and an insulin release will prompt a cortisol release. We recommend that you consider adrenal supportive substances. If your pets are undergoing known stress, you can provide great herbs, magnolia, ashwagandha, phosphatidylserine, that can help them through periods of stress to decrease cortisol release. We recommend also that you think about low stress diets. We're going to recommend that in addition to low carb, you feed a low stress type of diet, meaning moisture rich diet, to your pet. So the more species appropriate way you can nourish your pet is going to overall reduce biologic stress immensely over the course of your pet's lifetime, as well as moving your pet's body to give them adequate exercise really results in a lower stress lifestyle, which in turn can decrease the amount of stress that your pets have on their adrenal glands.